All right, today we are diving into a huge international study from the Lancet Oncology. It tackles a really tough question in breast cancer treatment, a decision that can seriously impact someone's quality of life long after the chemo is done.
So, let's get right to it. The question is this. When chemotherapy works great and shrinks a tumor way down, how much more do you really need to do? It's this constant balancing act, right? Between making absolutely sure the cancer is gone and avoiding a more aggressive surgery that can have lifelong side effects. Well, this study gives us some of the best data we've ever had to help answer that.
Okay, so here's our game plan. First, we'll lay out the difficult decision doctors and patients face. Then, we'll see how the researchers actually designed this study. We'll look at the big, overall result, and then, this is key, we'll dig into a crucial exception that really changes the whole story. After that, we'll cover what this all means in the real world, and of course, the bottom line.
All right, first things first, let's set the stage. We're talking about a specific situation where a patient gets chemotherapy before having surgery. The whole point is to shrink the tumor down to make the operation easier and less invasive.
So, after the chemo, the surgeons have to check the lymph nodes in the armpit to see if any cancer is left. And they have two main choices. The first is the big one, an axillary lymph node dissection, or ALND, where they take out a whole bunch of lymph nodes. The second option is much less invasive, a sentinel node biopsy, where they only take out the first one or two key nodes. The reason this choice matters so much is the risk of side effects, like lymphedema. That's a chronic, painful swelling in the arm that can last a lifetime.
Now, this study zooms in on a very precise moment. It's for patients who have that less invasive biopsy, and the results find something called micrometastases. What does that mean? It means the chemo did a fantastic job, but it wasn't a perfect wipeout. It left behind a tiny, tiny deposit of cancer cells. We are talking microscopic, smaller than a grain of sand.
And that leads us to the million-dollar question. If all that's left are these tiny cells, do you really need to go back in and do that big, aggressive surgery to clean them out? Or is it safe enough to just stop there and avoid all the risks of that bigger operation? For a long time, we just didn't have a good answer.
So, to finally get an answer, a global team of researchers got together to create the microNAC study. Let's take a look at how they tackled this.
And this was no small-time operation. They pulled together data from nearly 1,600 patients from 84 different cancer centers across 30 countries. That kind of scale is a really big deal. It means the findings are much more likely to be reliable and apply to people all over the world.
So what they did was essentially look back at two groups of patients. Everyone in the study was in that same boat. They all had just those tiny micrometastases left after chemo. About half of them went on to have the full, big surgery. The other half didn't. By comparing what happened to these two groups over time, they could figure out if skipping that extra surgery actually made a difference.
So, the moment of truth. What did they actually find when they compared these two groups? Well, the main result was pretty striking. Take a look. After 3 years, the chance of the cancer coming back in the armpit was incredibly low in both groups. For the women who had the extra surgery, it was 1.7%. For those who didn't, it was 2.3%. In the world of statistics, that difference is basically zero. It's a statistical wash. So the first big takeaway was, yeah, for the average patient, skipping the bigger surgery seems to be a totally safe bet.
So that's it then, right? Case closed. Less surgery for everyone. Sounds great. But, in medicine, it's almost never that simple. The real story is always a bit more complicated.
Because when the researchers started slicing the data by the type of breast cancer, a totally different and frankly, incredibly important picture started to emerge for one particular group of women. Okay, I know this slide looks a little busy, but just focus your eyes on chart D, the one down at the bottom. You see how those two lines are pulling apart from each other, way more than in the other charts? Well, those lines represent patients with what's called triple-negative breast cancer. And for this group, the choice of surgery mattered a lot. Let's put some hard numbers on that. For patients with triple-negative cancer who got the full surgery, the recurrence rate was just 2.4%. Pretty good. But for those who skipped it, that rate jumped all the way up to 8.7%. That is more than a threefold increase, and it is absolutely statistically significant. In fact, when the researchers analyzed every possible factor, having a triple-negative tumor was the single biggest predictor of the cancer coming back. We're talking a nearly 4 times higher risk. What that tells you is that the biology of the tumor itself was even more important than the surgery they chose.
Okay, so what on earth does all this mean in the real world? How does this data actually help a doctor and a patient make a better decision?
Here's the breakdown. For most patients, those with HR-positive or HER2-positive tumors, this data is fantastic news. It strongly supports the idea that you can safely de-escalate treatment and skip the bigger surgery. However, and this is a huge however, it does not support that approach for patients with triple-negative disease. It's also really important to know that most people in this study got radiation, and that played a big role. And finally, you've got to be honest about the limitations. This is a look back at old data, not a forward-looking randomized trial, and the follow-up is still pretty short. We'll need longer-term data to be 100% confident.
So after looking at all the evidence, all the nuance, what is the final, no-nonsense takeaway from this huge study?
The authors of the study really said it perfectly themselves. Their conclusion was, tumor biology should be taken into account when considering ALND omission. It's not just about what's left behind. It's about the fundamental nature, the personality of the cancer itself.
Ultimately, what this research really hammers home is that we are moving past one-size-fits-all medicine. The best treatment isn't some standard protocol for everyone. It's personal. The right decision comes down to the specific biological fingerprint of that individual tumor.
And that really leaves you with a big question for the future, doesn't it? As we get better and better at understanding the unique biology of each cancer, how many other standard, aggressive treatments are we going to find out are only really necessary for a small number of people, allowing everyone else to get a much safer, gentler path back to health?